Good. How are you? I was
Uh, Go ahead.
I could turn on my collab. I have on my robe. That's why I don't.
That's fine. No, that's okay. That's all right. Just
Okay.
put your name in the chat and your
Okay.
professor. That'd be great.
Okay. All right. Mm.
And then you and I will get going since it's only the two of us.
Yes, ma'am.
Okay.
Right.
Okay. Let me know if you can see my screen.
Oh, who are those cute kids?
Those are my grandkids.
Oh, they're adorable.
Oh, thank you. Okay. So, do you have your study guide?
Yes. Hold on just a second.
Okay.
I printed it off.
All right.
Okay. Yes, I have it out.
Okay, so this is the cover page, the first page that's on here. You know the chapters that are going to be covered, right? 1, 2, 3,
Mm-hmm.
9, 20, 21, 22, 23, and 31.
Okay. Mm-hmm.
And then also healthy people concepts, which is that it's the website. You don't need to know the website, but in each of the chapters in the book, they have a healthy people 2030 box that talks about national goals and objectives for each chapter, right? So they're different for every topic. So I would know those because there are healthy people 2030 questions on all of the exams.
Oh wow. Okay.
Okay. So I would go to those chapters, look up the box for healthy people 2030 and just review the goals and objectives. And each chapter is a different topic. So therefore the goals and objectives are going to be different.
Okay.
All righty.
Mm-hmm.
And then this is really, I mean, multiple choice questions, select all that apply, math problems. And at the end of this study guide, it's kind of nice because we've put in some math formulas, right? Drip
Mm-hmm.
calculation formula, how to set up an infusion time, how to calculate dosages. So please, if you struggle with math, review that, okay?
Okay.
And then we just go through what the important concepts that are going to be covered on this exam are. The first one listed on your study guide is priority and safety assessment. Okay, so
Mm-hmm.
what that means is using our ADPI, right? We're using our ADPI, which is our nursing process,
Mm-hmm.
right? In community, we use the ADPI, obviously, and we need to be able to kind of transform that ADPI from your clinical setting into the community setting. So assessment in the
Okay.
clinical setting looks different than assessment in the community. Assessment in the clinical looks different than assessment in the community. That's what that means. So the nursing process applies all through this class, community health. You just have to be able to apply it differently to the different setting because now you're in the community, right?
Right. So, like
And
example, like
so
of how it's different.
for example, you may be taking care of an adult patient in the hospital with CHF.
Mm-hmm.
Okay. That's good. The assessment of that is going to look different than when the patient comes home and you do an assessment of the patient's needs in the home setting.
Okay.
Make sense?
Yes, ma'am. Mm-hmm.
So ADPI is applicable. Safety, you're always thinking safety, ABCs, right?
Yes.
And so so there's a whole bunch of sections. So priority safety assessment, acts and organizations that play a role in public health. It's split out for you. Management of care across the lifespan, school nursing, family assessments, home visits and interventions, primary, secondary, tertiary, healthy people 2030, vulnerable populations, evidence-based practice. So all these are concepts that were covered in the first 2 weeks. So what we've done for you in this study guide is give you several bullet points under each concept. And this is what you need to study for the exam. Okay. So my suggestion is always to start with the study guide. Okay. The study guide is a summary of all the concepts we've covered. Okay. So if you get to a bullet point, for example, risk factors for SIDS. No definition and how you would do levels of prevention for safety and reducing mortality. If you can't answer that off the top of your head from lecture, notes, readings, then you have to go back to that chapter and wherever it came from and read that section. Okay, so it's asking you, what are the risk factors for SIDS? Know the definition and know the levels of prevention. So let's do levels of prevention for SIDS. Okay. So what this tells you is there's going to be a question about SIDS on the exam. So we need to know the risk factors and we need to know the definition and levels of prevention for safety. So what would be a primary prevention for SIDS? You guys know about primary, secondary, and tertiary, right? What's primary?
Like you're preventing the issue from occurring.
Preventing something before it happens, right? So what would be a primary intervention for SIDS?
Make sure you're laying the baby on their back and that there's no like blankets or anything in the crib or the bassinet with them.
Yep. Yep.
Not co-sleeping.
I'm thinking more on a level of educating new mothers on the risks of SIDS.
Oh, okay.
Right? Trying to prevent something before it happens. Secondary is screening. So secondary is early identification, early intervention. So if we identified maybe babies who would be at risk of SIDS, maybe they sleep on their, sleep on their stomach or sleep on their back, whatever. We would have, or they've had maybe a previous baby die of SIDS. I don't know, but that would be secondary, right? So we would be identifying babies at risk for SIDS. Okay.
Okay.
And then tertiary, this is if something happens, right? Tertiary, something has to happen. Maybe the baby has died of SIDS. So what interventions are put into place at that point? Does that make sense?
Mm-hmm.
I'm not going to go through every bullet, but I'm just trying to give you the gist of how to go through the study guide. Second bullet, we're asking you, what are some of the interventions needed to enforce primary level of prevention for a whole family based on goals and lifestyle changes? How would you accomplish this? Okay, so primary level of prevention for an entire family based on goals and lifestyle changes. What are some primary preventions? Let's say you're meeting with a family and you're discussing goals and lifestyle changes. What would be primary?
Diet.
Yeah, teaching them about healthy diet, healthy exercise, maybe effective communication skills, positive parenting skills, right? You're trying to prevent something before it happens. Okay?
Yes.
Next bullet, review 2030 principles on safety for adolescents. Okay. So as I told Carla at the beginning, before other students came in, please review all the Healthy People 2030 boxes in the chapters you're responsible for. There are Healthy People 2030 questions on there. And what you're responsible for knowing is what those goals and or objectives are for each chapter. So this is actually giving you a very specific topic to look at. What are the 2030 principles on safety for adolescents? So go back to that chapter. If you can't answer that now, go back to that chapter and look at your Healthy People 2030 box, and it's related to safety for adolescents. Make sense?
Mm-hmm.
Look at violence, weapons, drug abuse, alcohol abuse, motor vehicle concepts. Remember, these are the leading causes of morbidity and mortality for adolescents. Okay, so right here, if you were asked, what are the leading causes of morbidity and mortality for adolescents? Weapons, drug abuse, alcohol abuse, and motor vehicle accidents. Okay. Safety assessment. Identify what environmental things you should look for when assessing common areas on the playground. Know what would put a child at risk. Priority intervention, safety. So there's a section in that chapter of the book that talks about playground safety. Let's say you were the community nurse and you were asked to participate on a multidisciplinary team that's going to build a new playground, and they're asking you for your expertise on how to develop and build a safe playground. Okay, what should you do? What shouldn't you do? And there's a small, I think it's a little box in that chapter that says, the ground should be not concrete. There shouldn't be any loose hooks. There's 5 or 6 different things that you shouldn't do. So that's what that means. Okay. I'm just going to keep going through here. Review concepts of prevention when it comes to smoking in children diagnosed with chronic conditions. How would a community do a primary and tertiary intervention? Okay, what that means is you're caring for children diagnosed with chronic conditions. How does smoking affect that? Okay, asthma, secondhand smoke. There's a whole section on that. Okay. And then understanding the differences between primary, secondary, and tertiary, and be able to distinguish between all three. And remember, that's the other thing you should review in each chapter. Review the Healthy People 2030 box, but also review the levels of prevention box. It's in every chapter, primary, secondary, tertiary. And the reason why you have to review it in every chapter is because the interventions look different. Let's say your chapter is environmental health. Well, primary, secondary, and tertiary is going to look a lot different than if you're in the chapter about the school nurse, right? They all apply, primary, secondary, and tertiary, to apply to every concept that's on this study guide and actually throughout your book. You just have to be able to apply different interventions to different topics, right?
Mm-hmm.
Know the definitions of family, right? There's 2 definitions of family: structure and function, right? So go back and review that. What is the RN's? I mean, we're asking you specific questions to study. What is the RN's role in health risk reductions? There's a whole section on that, on risk reduction. How do we do that? Next section, know what the FMLA is, right? We know what that is, Family Medical Leave Act. How does it impact communities? This is providing the opportunity to take time off to care for yourself or a loved one. Please review the differences between Medicare and Medicaid. Okay. I just can give you, there's a box in this chapter that it's side by side, the comparison of each. The main point to know is that Medicaid is needs-based, and it's for anybody, needs-based, that qualifies. Where Medicare, the 2 qualifiers are over 65 and any age with a disability. Okay. Be able to define what the Affordable Care Act is. Understand why nurses choose public health, autonomy, and independence. So think about it. If you're a nurse in a hospital or long-term facility or wherever, think about, you have a whole team there to support you, right? You have food services, you have maintenance, you have environmental services, you have all the support teams right there at your hand, right? But think about the community. You're going into people's homes. It's much more autonomous and much more independent. Yes, you have your resources that you can call if you have issues, but there's much more independence in the community nurse role than there is in a hospital nurse role. Does that make sense? What is the purpose of Healthy People 2030? How is it different from Healthy People 2020? That's in the first chapter. I think the first chapter introduces you to Healthy People 2030 and has a side by side of how it's different from Healthy People 2020. Okay. Next is QSIN. I don't know, you may not, I'm not sure if you've picked up on this in your readings, but each chapter has a QSIN box. QSIN stands for Quality and Safety Education for Nurses. These are competencies. Okay. I think there are 6 competencies. So each chapter will take one of those competencies and apply it towards the topic or the concept in that chapter. Okay. So QSIN is competencies. It is not a federal health agency. Is it a federal health agency? No. It's not the CDC or not the NIH. These are nursing competencies. Make sense?
Mm-hmm.
Know what the purposes of the key organizations are. Okay, this is all in your readings. Just know, just have a 1-sentence definition. What is the responsibility of the CDC? What is the responsibility of the World Health Organization, the NCHS, and the Institute of Medicine? So please find what each of these 4 agencies does. Okay. What's the difference between advocacy and social justice? Again, in your readings and should be in the lecture. Okay, what's advocacy? When we advocate for our patients, what are we doing? Nurses are advocates. We're acting in their best interest, right? What's social injustice?
Like, is an example racism, or
Or what?
is it social injustice? Is that like racism, or
Or racial
how,
inequity. Inequity.
inequity?
How does that sound?
Yeah.
Okay, but know the difference between advocacy and social justice. And like I said, all these little bullets are in all your readings. And a lot of it should have been covered in video, the recordings you're getting. Okay, what's the goal of primary health? Okay,
Prevention.
yeah, trying to, yes. Management of care across the lifespan. What's self-determination and how does it apply to issues in care management? What is self-determination? What are some patient goals and practice self-determination? Self-determination is you want the patient to be participating in their care. You want them to, if they're capable, you want them to have input in the planning, the goals, right? You want to give the patient really kind of self-advocacy. Okay. And again, it says, understand the definitions of primary, secondary, tertiary, and be able to provide an example. You're going to find that in every section. What's a durable power of attorney versus a DNR? What's the difference between community-based and community-oriented nursing? Let's say you're given a scenario and you're asked, is this community-based or community-oriented? What's the difference? What have you learned? What is community-oriented nursing? Does it focus on one person or the whole population?
The whole population.
Yeah, the difference, this is how I remember it. Community-oriented nursing, I think of like the big picture. You're trying to orient yourself to the whole community. You're looking at health promotion, health needs. You're kind of doing an assessment of what the overall community needs are. So you're orienting yourself to the community. Where a community-based nursing, you're based in the community working with the ill population. Okay, or you're working within the community. Okay, so for example, school nurse. School nurse is in there in the community working with the kids in the school. Hospice nurse in the community working with clients with end of life issues. Occupational health nurse. That's a community-based nurse. She's working in the workplace to try and ensure safety and productivity, or health safety, and prevent injury. Do you understand the difference? Okay.
What if you work at like a health clinic? Is that community based?
Yeah, that's a community based.
Okay.
Community oriented means you're looking at the whole community in more of a primary way. What's going on in the community? What are the needs? Health promotion. So there's a stark difference
Can you give us an example of that?
of
The community
The orienting.
oriented.
a community oriented nurse would be maybe a public health nurse that's assigned to look at the whole community, the community as a whole. The goal is to try and keep the community as healthy as possible. So she's looking at it from a community perspective.
So is that more like, I guess, because I'm not under, so is that more like a research, more like that nurse is more looking at like, um, I don't know how to word it, but
She's looking at the community as a whole versus taking care of the kids in the school. Her focus is on the health of the community
so like a
So
versus
health
is that,
fair.
oh,
what?
is it something like the job and family services when they have nurses right there or something like that? Is that
Nope.
what you're talking
That would be
about?
community based.
Oh,
The
okay.
community oriented nurse is looking at the community as a whole. Any specific services that are being provided in the community are community based. Okay.
Mm.
School nursing. Take a look at your Healthy People 2030 box in your school nursing chapter. Know what their objectives are. Okay. What's the role of the school nurse? You need to know that. This is all in your readings. Be able to look at the primary, secondary, tertiary box in your school nurse chapter. It gives you great examples of each level specific to the school nurse. Okay, in school nursing, you have to prioritize. Let's say 5 kids came to the clinic with all different issues. How do you prioritize who needs to be seen first? Remember your ABCs. What has to be dealt with immediately versus what needs to be dealt with, but it can wait till after the student that may have safety issues going on. So which ailments, if presented with various ones that the child could present, would take priority over the other. Okay. So you may be asked a question in which like I said, 5 kids come to the clinic, who has to be seen first? And then know about conjunctivitis. Right? What do we do with conjunctivitis? Certainly hand washing. We put warm compresses to the affected area, not cold. Okay. Family assessments. What does a functional and a dysfunctional family look like? This is in your family chapter. There's a box in your chapter that I think it says the functions of a healthy family. So you just need to take the opposite of that to be dysfunctional. Okay, so you may be given a scenario and asked, is this an example of a functional family or a dysfunctional family or a healthy or unhealthy? Okay. And remember your eco map and genograms, right? Your genogram is your family history, genetics. So if something happens that's not familiar, not known, hasn't happened in the family, you may be asked to do a genetic map. Where an eco map is the social connection your family has to the community. Are you involved in church? Are you involved in sports? Are you involved in book clubs? The more social and interactive the family is with the community, the better the success. Okay, so an eco map is the social structure, the social connections with the community, whereas the genogram is the generational map of what's gone on in the last 3 generations. Okay. This kind of says the same thing. What are the characteristics of healthy versus unhealthy? Vulnerable populations. Who are the vulnerable populations that are identified in your book? There's a lot, but what are the primary ones?
Homeless.
Hmm?
Old
Homeless.
age.
Homeless, teen
Mhm.
pregnancy, veterans,
Rural. People in the rural community. Could that
rural
be?
community, mental health issues, substance abuse issues. Again, here, know your levels of prevention when it comes to vulnerable populations. All right, so go to your chapter on vulnerable populations and know your levels of prevention. There's a box in that chapter that gives you several examples at each level of intervention for vulnerable populations. And then another big topic that we cover in this course is aging populations. What are some community and nursing considerations? How do we manage at the 3 different levels to foster positive outcomes? Okay, and this is all covered in your across the lifespan chapter. And then lastly is ethics. Okay, what is evidence-based practice?
Mm-hmm.
Evidence-based practice is using the best, most current evidence, research, data, information that we have for our profession of nursing. So, for example, 10 years ago, people who had heart bypass surgery may have stayed in the hospital for 10 days. Now they stay in the hospital for 2 days. How'd that happen? Well, research, evidence-based, peer-reviewed evidence has come forth that we can care for these patients in a better and different way. Okay, so we are always using the most current that's best practice. Evidence-based practice is best practice. You all know what best practice is, right? Yes? Okay. So you have a whole chapter, you have a chapter on evidence-based practice. How do you implement it? What are the goals? What are the barriers? Does anybody work with anybody that always says, oh, we've been doing it this way for 40 years, it's fine? Anybody work with anybody like that?
Yeah.
Right. And so those are the people that are hard to change to move forward with doing things maybe more effectively, more ensuring more positive outcomes. So a lot of people are resistant to evidence-based practice because it means an update, a change to your practice based on new information. And then please know the purpose of the Nurse Practice Act. Okay, that's in your government chapter. Okay. And then, like I said at the beginning to Carla, here are 1, 2, 3, 4 really simple examples of how to set up formulas, drip calculations, infusion times, and how to calculate doses. Okay. So if you struggle with math, make sure these are standard ways to set this up. And I also sent you guys a link to Professor Bogart's YouTube channel, right? In which she does a very simplistic training on those three: setting up drip factors, setting up formulas. So if you struggle with math, have a look at, well, I don't know. I'm not sure. For my students, I sent that to them. I'm not sure if your professors, but if not, ask them to send you Professor Bogart's YouTube channel and medication training. Okay. So that's how I would tackle the study guide. Use that in conjunction. I would start with that, maybe highlight what you're totally comfortable, check that off. I know that. And then the bullet points that you're a little bit unsure of, highlight and go back and do your research. Go back to your lecture recordings, go back to your notes, go back to your readings, but you should be able to articulate every bullet point on that study guide. And if you're able to do that, you'll be in the 90s on the exam. I promise. Okay? Does that help?
Yes. Mhm.
Questions?
Yes.
Thank you. Um, hmm, I just want to make sure that I have primary, secondary, and
Okay.
tertiary, right?
All right.
Um,
Mhm.
so would primary be, because I get confused, is that like vaccination?
Yep.
Is that primary?
Yeah. So
Um,
what do vaccinations do?
they're preventing.
Exactly. That's what primary is, preventing something before it happens.
And then secondary, is that more like a health fair or like pamphlet? What is, that's where I get confused.
I call secondary early identification, early intervention. So it's
Oh, like
screening for at
Oh, okay.
risk. So yeah, health fair. Let's say you're doing blood pressure or blood sugar screenings at a health fair. You're screening for people that might be at risk,
Okay. Health. Okay. So
right?
like a mammogram is secondary.
Exactly.
Okay.
Yep,
Or a colonoscopy that can be
exactly.
considered. Okay.
Screening. I do P for prevention, S for screening, and T for treatment.
Oh, yeah, that's an easy one.
Can you
Have
say that
your
again?
P for prevention, S for screening. So we're screening for at risk, and then T for treatment. And remember, at the tertiary level, you have to have something, a disease, a condition, or something's happened, right? Yeah. And then you work to treat the condition or the disease or help manage it, provide education so that they can be the client can be as self-reliant as possible. Okay. So for tertiary, they already have to have something going on. Substance abuse issue, mental health issue, diabetes, stroke, whatever. Because then you're working to help them manage, help treat that.
Okay.
Does that
And
help?
then I have another question.
Mm-hmm.
Um, like, can you give me an example, like for this one? It says like, how does this come into play when doing care for children diagnosed with a chronic condition? How would a community nurse would make recommendations and access interventions? So me as a community nurse,
Mm-hmm.
if they're diagnosed with a chronic condition, like what's an example of what I would do
So if
for,
they're diagnosed with a chronic condition, you are going to assist the child or the parent in helping to manage their chronic condition,
oh, okay.
right?
Like, so recommendations would it be like, well, as a nurse,
Teaching, Think about it. Think about if you walked into
Mhm.
a family's house and they had a small child that was heavily impacted. What would your role be? How are you doing? Do you need some support? Do you need us to teach you how to do trach care? Do you,
Oh, okay.
right? What's
Hmm.
what resources do you need? Do you have enough supplies? Are you comfortable taking care of your child? Right?
Okay. Yes. Teaching. Gotcha.
Does that help?
Yeah, I'm just kind of going over the ones that I
Yeah.
just was a little shaky on.
Yeah.
Um, and then you have mentioned evidence-based. I understand that, but you said best practice. Can you explain best practice?
Well, think about it. What's best practice?
I mean, I guess it's
We,
you
our
try
entire nursing profession is based on best practice. We are always providing the best practice that we
best
can based on the knowledge and
evidence.
information we currently have.
Okay.
Right? Best
Um,
practice is you're a critical care nurse. You're always going to training and retraining and learning new things, learning new ways to do things. Best practice as a labor and delivery nurse. You're always learning the most up-to-date information with regards to labor and delivery and care for mom. That's best practice. We want to always be on
well,
top. What?
what, but best practice versus evidence-based. Like, what's
Well,
the,
yeah. I mean, your best practice comes from evidence-based, right? It comes from evidence,
oh, okay.
right? Evidence-based practice is we're using the most up-to-date, accurate information to provide the highest quality of care that we can, which essentially is we are using our best practice.
Okay.
Make sense?
Yes.
Okay.
Um, yeah, that's pretty much.
Okay. Is this helpful to go through it like this?
Yes.
Hmm.
Okay.
Great.
Yeah. Yeah,
I have a
I think
question
so.
on
Yep.
EcoMap.
What?
I don't know if it was EcoMap. I don't, it was discussed in lecture and I just had a question mark next to it.
I'm sorry, say that word again.
I could be wrong. I wrote EcoMaps.
Oh, ecomaps. Yeah, we just went over that.
ECOMAP.
Yeah, we just went over that. That's the
Okay.
genogram versus the ecomap. Remember, genogram, you're
Okay.
getting a family history over the last 3 generations, where the ecomap is the social connection that the family or the individual has to the community, right? Because you want families to be engaged in the community, right? You don't want them to be isolated. I always use the example of an ecomap before COVID. You were in the circle. Then you had family, friends, relatives, religious services, book clubs,
Coworkers.
coworkers, everything. And then what happened with COVID? What happened to your eco map? We were all in
Um,
lockdown. Your eco map
Isolated.
went away,
Yeah.
isolation,
Yeah. Okay.
right? And now we're all starting to build our eco maps out again. So eco maps are your social interaction, social connection to your community.
Connection. Okay.
Does that help?
To community. Yeah. What was the other one? You said it was something versus EcoMap.
It says
Genome.
genome in the study guide, but I call it a genogram. And just think about
Okay.
gene. What's gene? Hereditary.
Right. Okay. Thank you.
You're welcome. Judith, do you have any questions?
No, I just have to read more.
Yeah, know your study guide.
Yeah.
That's what I can suggest. Start with your study guide. If you have to go back and re-review those bullets, please do.
Okay.
What's on the study guide is what you're expected to know for the test.
Okay. Okay.
Okay.
Okay.
And you have plenty of resources. You have lecture recordings for the last 2 weeks. You have readings, you have notes that you've taken. All the information is at your fingertip. Okay?
Okay.
All right. Well, thanks, ladies, for coming. Good luck on your test.
Thank
Thank you.
you.
Yep.
Thank you.
You're welcome. And then I'll be sending this recording to your professors. And as we're all doing reviews this week, we'll be recording it and sending it to everybody. So you'll have several
Okay.
different recordings as well.
Okay.
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 Okay?
Thank you.
All right. Thank you. Have a good day.
You're welcome. Bye.
Bye-bye.
Bye.
Bye.